Welcome to the Alcidion Insights Series. In-depth interviews examining workflow challenges and opportunities for digital innovation on the front line of healthcare. Join us to learn how Maya Precision can support your team. Many health services have invested heavily in EMRs. Why isn't that enough?
EPRs, I think by definition, the challenge is they create another boundary, they create another silo. What we're trying to do is enhance what EPRs already do.
Because it's not just digital that's needed, it's the workflow management. So you can put a digital system in place, but if you don't have the clinicians on board, if you don't train them, if you don't digitize the workflows, then you're not necessarily going to improve any of the efficiencies or the outcomes for the patient.
What is the difference between digitising a patient record and digitising clinical workflow?
Digitising a patient record is an interesting concept rather than digitising a clinical workflow. A lot of people start off and they think, I've got this wonderful form and I'm just going to create a digital format of it. And essentially it's a Word document in a digital format. That's not really recognising the value of digitising something. Essentially it's just creating an electronic format of a dumb document basically. Whereas if you're looking at the workflow, you're looking at something from the perspective, well, what information am I capturing along the course of care delivery for this patient? How can I bring that together? How can I surface that at the appropriate time to support a clinician in their care delivery?
What it means is you can suddenly see everything about the patient that you couldn't see before. So you can see all of the results, you can see where those patients are in the process, and what more importantly you need to do to treat is how to treat them in a holistic way. So can I treat the patient properly rather than just looking at little bits of data and snapshots here and there? How can I process them through the whole facility?
Where do clinicians still experience friction, even in hospitals with mature EMR implementations?
Because even with mature EMR solutions, there are still gaps in some of the workflows. So the clinicians will have workarounds for things such as handovers. There'll be corridor conversations. Nurses, for example, will still use whiteboards to get some of the data that they feel is missing in the EMR. So even though you do have the digital solution, it's not all visible on a single screen in many of the solutions.
I think that goes back to the silo question of I can see this much about the patient, but I can't see the rest of the stuff. And more importantly, I can't move them through the various stages I need to move them through to treat them efficiently, treat them quickly, and treat all of their problems.
How does workflow digitisation change the day-to-day experience for a nurse or doctor?
From the perspective of a nurse or a doctor, and when you're speaking to them about workflow digitisation, from their perspective, they just want their workflow. And they don't really want their workflow to get harder, they want it to get simpler. And this is where digitisation can help them. It can help them by them not having to remember everything, by the solution suggesting things based on a care plan as assigned for a patient. We have built this solution that supports them in the way they need to document care. And one of the early feedback comments that we got from one clinician was, I got to the end of the day and I thought, I must have missed doing something today. I have so much more time available. I must have forgotten to do something. So it's making them more effective and more efficient. And what that does too is it releases time to direct patient care, which has got to be the most important thing.
What does beyond the EMR look like in practice? What should health services be aiming for?
Beyond the EMR. It is an interesting thing because I think there's still a little bit of that out there in the industry that unless you've got an EMR, you're not doing the right thing. And I think the healthcare industry has got to evolve as well too, to recognise that the EMR is good in terms of the context of what it's meant to do. But the EMR per se is not necessarily going to address those issues that are facing all healthcare services today, in that demand is far exceeding capacity. How do I work smarter? How do I work more efficiently? How do I work more effectively? How do I manage the patient beyond the walls of the hospital as well?